Hello, everyone. I'm Dr. Lisa Waddell, the Chief Medical Officer with the CDC Foundation and your moderator for today's event. It is my pleasure to both welcome and thank all of you for attending today's webinar, focusing on the latest on COVID-19 testing, what your community needs to know. The CDC Foundation is so pleased to host this webinar in partnership with the Vaccine Equity Cooperative and Health Leads. This webinar is the 9th in a series and is part of our ongoing work and commitment to support those of you working in communities and partnering with communities to fight this pandemic. Now, a couple of logistics. Today's webinar is available in Spanish. To listen to this presentation in Spanish, click the globe interpretation icon at the bottom of your Zoom screen and select your language. This webinar also has closed captioning option. To enable closed captioning, please click on the closed captioning icon on the bottom of the Zoom screen. Now, some housekeeping. Today's webinar will be recorded and sent to everyone who registered along with any materials shared. During today's webinar, we will have time to answer as many of your questions as possible. So please submit your questions using the Zoom Q&A button found at the bottom of your screen. You can also use the Zoom chat feature to share comments, reactions, link with your fellow attendees and panelists. And last but not least, at the end of the webinar, we will be launching a poll and evaluation survey. So please take the time to quickly share your feedback on today's webinar and suggestions for future offerings that may be most helpful to you. Now, as you know, the demand for more COVID testing rose quickly in recent months, along with the Omicron variant. New initiatives, including the federal government's recently launched at-home testing distribution program, are designed to increase access and affordability. But with multiple testing options available, it's easy to get confused about which testing method is best in a particular situation, what is the most efficient way to get and administer at-home test, and what to do in case of a positive result. As important trusted messengers, community-based organizations and workforces need to be equipped with the latest information on testing to keep their communities informed and protected. So during this webinar, experts will share an overview of all of the COVID-19 test opportunities currently available, discuss the federal government's plan to equitably distribute at-home tests, and answer some of the most frequently asked questions that CBOs may be getting about their communities, where they can get tested in order to be best protected. So to cover these topics, we are thrilled to have a number of expert speakers on these topics. Our agenda includes an overview of the White House testing program, highlights about the important role of CBOs in facilitating access to testing and testing information, updates on federal resources available for COVID-19 testing, information on various types of testing, and then we'll be answering as many of your questions as we can. So stay tuned. We have a busy hour and we're excited to share all of this information with you. So we're going to kick off this webinar today with remarks from Dr. Cameron Webb, who is a Senior Policy Advisor for Equity COVID-19 Response Team at the White House. Dr. Webb is an accomplished physician with an internal medicine background. He was previously an assistant professor of medicine and public health sciences and director of health policy and equity at the University of Virginia School of Medicine. So I am super pleased to introduce and to welcome and to thank Dr. Webb and my co-alumni from the University of Virginia for joining today's webinar. Dr. Webb, over to you.
Well, wahoo to you, and it's great to be with you. As you can see, for those of you who can see my video, I'm currently in a pediatrics office, and it's pretty apropos. You know, we're talking about testing, and I just got a call from my daughter's school that she had some sore throat and stuffy nose, and so they sent her home, and we did an at-home test. It came back negative, but we're here getting a PCR test so that she can hopefully go back to school soon. And so that's just kind of the world that we're living in these days, which is different, but we're all adapting. So she's right behind me getting a COVID test right now. But in any case, I'll talk briefly about the new program, the at-home rapid test. And the first thing I'll say is that this is one of several federal efforts to get tests to people. Certainly since September, we've been sending COVID tests to community health centers, to FQHCs. It was 25 million at first, but then 50 million tests eventually. Since January 15th, we've been working with private insurers. And for the over 50% of folks in the country who have private insurance, they can get 8 tests per month per insured individual. And we know that at least 50% of those insurers themselves, according to a recent study, are offering it free at the point of sale, which is pretty exciting. And we're encouraging all insurers to do that same thing. Certainly, we're sending tests to folks in long-term care. We're sending tests to organizations that serve people experiencing homelessness. And we're making sure that there's a lot of testing capacity, like the clinic where I am right now, to get PCR tests for the community as well. About 200 tests available, 200 million tests rather, available this month. And that's in addition to the 375 million at-home tests available for purchase this month. That's all part of the paradigm, but we needed to do more. And the president called for us to do 500 million tests that we're sending directly to people's homes, and that's what we aim to do. COVIDtest.gov is the website, and the phone number is 1-800-232-0233. And what's important about that is that there's no ensuring access to these tests without having both online and telephonic access. So we wanted to make sure those are both available for folks. And this opened up just about 2 weeks ago now, and people started being able to order these tests. And in those 2 weeks, over 60 million people, 60 million different residents have ordered at-home tests. You get 4 tests in a test kit and 1 test kit per resident. And the idea is we wanted to get at least some tests out to as many different people as far and wide as we could here in the U.S. And along those lines, we wanted to make sure that we're reaching the hardest hit, highest risk communities as well. So we were actually really pleased to collaborate with the National Association of Community Health Workers, which is a network of promotores, de salud, and community health workers, but also to collaborate with Made to Save and Faiths for Vaccines and Health Leads and other organizations as well, because when you pull it all together, we really want to be in community with folks who are from community, talking about the need for tests and getting the word out there. And because of that work, in these first 2 weeks of the initiative, we've had 43% of those 60 plus million tests ordered that are going to high SVI communities, or the highest risk, hardest hit communities that we have. So that's good news. Of course, the work is not done. We have to make sure that there's linguistic access on our call line. That's how we have over 150 different languages. We have to make sure there's access for folks who are living in multi-family housing. So that's why we created an adjudication process where people can click a link on the FAQ page, or they can call the line and say, actually, there are multiple families who live at this residence. We're continuing to work closely with communities because we recognize in some indigenous communities, for instance, there aren't your typical residential addresses. So we're leveraging some of our other programs through HHS to get tests there as well. We're really putting this in the context of the range of other programs that we have. No one program can do everything for everybody, but we want to get as much mileage out of this particular initiative as we possibly can, try to get tests to folks. And like I said, with 65 million folks who've already ordered tests for their residents, we recognize we still have some left over. So if there becomes an opportunity for folks to order additional tests, we want to take full advantage of that. The president's already called for an additional 500 million tests to be sent out as well. So we're procuring those. We want to get these out to communities as swiftly as possible so people have this access. So lots to do, but we're equal to the task and most eager about it because of our ability to collaborate and coordinate with community-based organizations, faith-based organizations, and community health workers, the folks who know the community the very best. So with that, I will pause and I will pass it back over to you.
Thank you so much, Dr. Webb, for sharing that really important information. We really appreciate it. And we know that you've got some important personal business going on there with your daughter. So certainly appreciate your time. We do have a couple of questions if you have just a couple more moments to pose to you. Can we go ahead and proceed with that? think he's on mute. Okay,
Sorry,
great.
you want
He's
me to
off.
look at the Q&A?
Yeah, so let me pose a question to you if you're able to. So a lot of people have found the website helpful in ordering the test, but some people need support or help ordering the test. So you mentioned a phone number that people can use in order to use the test. And is that available in multiple languages?
Yes, and I did answer that, I think, when I gave my remarks. So the phone line, again, that number is 1-800-232-0233. And that line is available in over 150 different languages. So English, Spanish, plus 150 other languages as well. Wanted to have really broad access via that phone line. And so that'll help people navigate. And we're also, I think that's part of why we're working with community-based organizations. And Nashua has done a great job doing trainings to help folks who are assisting community members and the other folks in their communities with getting registered for the test. They've done some great trainings, put together some great materials that they've been able to share. I know Made to Save has had access to that, Health Leads, Partners in Health, Unidos US, other organizations as well. So I think there are a lot of resources there available for you. And again, the phone line is certainly available in multiple languages. The website's available in English, Spanish, and Chinese. So wanting to make sure this is as accessible as possible.
That's great. So one additional question. We know that the federal government's mass distribution program is not part of this at-home test distribution program, but we have received a lot of questions with people asking where and how they can pick up their mask. Is there any information that you might be able to share where people can find more information on that particular program?
Well, a couple of things. First, that program is, as you mentioned, it's separate from the testing program. I think because they rolled out around the same time, a lot of people connect the two, but they're coming from completely different places. So the masks are coming from the Strategic National Stockpile. That's 400 million masks. And instead of going to people's residences, that's going to pharmacies and community health centers. Now, in the announcement, what was stated was that really it was by mid-February. We would expect those to be at those different facilities. They've already started showing up in some communities, but certainly not in all of the different communities that we expect to have by the time that program is fully live by mid-month. So in just about a week and a half or so. But the idea is it will be in tens of thousands of pharmacies and community health centers. We've got 1,500 community health centers here in the country, and of those, several hundred have signed up to receive and distribute masks as well. And so once we have everybody kind of enrolled and engaged and ready to pass out those masks, we'll make sure that we're able to get that information out to you all, and we'll certainly look to organizations like Health Leads to distribute that information, other community-based organizations and national entities who've been great coordinators throughout the pandemic response. We'll make sure we share those, and we'll be getting them out to state leaders so they know what's available, what pharmacies and community health centers in their states. And so we'll, I think as that goes, fully live in the next week and a half or so, we'll make sure that information gets out.
That's fantastic. So to everyone, I think that's really valuable information to know, to really pay attention to what the resources are going to be in the pharmacies all across the country, as well as FQHCs towards the end of February. So are there any words of wisdom or inspiration you'd like to share with the attendees before you need to go, Dr. Webb? You're in the thick of this every single day, as many of our community-based organizations. Anything you'd like to share?
Well,
anything else?
So this is my daughter. She just got her COVID test, and so I think this is what it's all about. We want to be able to have access to the ability to test when it's unexpected and you're supposed to be on a call doing a presentation, but instead you need to get a family member tested. We want that to be available for everybody, and I think that it's just a combination of hard work, of coordinating in community, and making sure that we're doing everything we can. What I keep saying is that federally we want to be a partner to the community as much as possible in this. I'm really intentional about making sure programs like this are not fixed. There's not one way to do it, but your feedback actually changes the program. It changes how we reach people, where we reach people. So please don't hesitate to give feedback. We don't take it as just criticism or critique. We take it as opportunities to iterate and improve. And that's what we want to do. We're trying to beat a pandemic here, and we're trying to do it in the best way possible. And your feedback is critical to that. So keep it coming. We've got thick skin. Don't worry about us. We just want to get this right for communities, for as many people as possible. And I think that already the feedback from the folks at Health Leads, at Made to Save, at Face for Vaccines, at Partners in Health, Unidos US, the ARC of the US, US Aging, other organizations, that has been critical to our being able to develop the program to the point that we have. And we want to keep going. We want to keep doing that. This pandemic's not over yet. Plenty more to do, but we're going to be able to get it done because we're going to do it in partnership with you. So thank you so much for your time, for your attention. And look at her. She's fine. She's just fine. She's not worried about anything. So, all right,
she's a trooper, Dr. Webb, and thank you for sharing your knowledge, your expertise, your personal experience, because you're right. That's what it's all about. You're getting a lot of kudos in our chat here, and appreciation and acknowledgement for the information and the work that you're doing. And we certainly appreciate the spirit and the manner in which you clearly said your feedback is important. It is an opportunity to iterate and improve. And for those that are community-based organizations, health departments, FQHCs, and so many others on the ground doing this work, I know that they appreciate that opportunity to share that feedback so that we all can continue to, turn the tide on this pandemic. So thank you so much for joining us today.
Thank you. Bye, y'all.
All righty. So let's see here. We are now going to move to our next speaker. And you heard her organization mentioned by Dr. Webb a couple times, and that is Dr. Alice Chen, who is the Senior Advisor of Made to Save. And Alice has certainly been a great partner in all of this work. And she's going to speak to the important role of community-based organizations in accessing testing and testing information. So Dr. Chen, welcome.
Thank you so much. It's so great to be here. Thank you to you, Dr. Waddell, to the CDC Foundation, Health Leads, and National Association of Community Health Workers, and all of you out there who have been doing so much incredibly hard and incredibly important work throughout this pandemic, and particularly with the rollout of this testing program. When this pandemic has taught me so much, and one of the most exciting things that it has taught me is the power of community-based organizations and the crucial role that community-based organizations play in everything, but certainly to our pandemic response. When the COVIDtests.gov program was just getting ready to be launched, I think there were a lot of questions of, I don't think anybody expected the numbers that Dr. Webb just quoted, that 60 million households would have already ordered, and that so many of those would be the 43% in high SBI, high need communities. I think no one really expected that because you expect, well, there's internet access issues and information issues and language access issues, but the people who know how to deal with that are community-based organizations, and that is exactly what we've seen in this program. The week before the website was to be rolled out, I know it was just a couple of days before that a lot of community-based organizations got the word that, hey, we're going to have access to this website, so get going, and we need to organize in our communities. And I watched organizations drop everything on a Friday before a holiday weekend, and spend the entire weekend gathering the names and addresses and talking to people in their communities and getting hundreds of people ready to go, thousands of people ready to go to sign up for those tests. I have to give a shout out to some of Made to Save's partners on the ground, Uma Tulsa, Promise Arizona, Proyecto Vida Digna, so many others that just they hit the road, they hit the streets and really made it happen. And it's because of that so many people in communities who are so used to being left behind were not left behind in this instance. And I know there are still many, many more people that we need to reach, but I think this has really been a testament to the power of combining, the might of the federal government with the like unbelievable grassroots power of community-based organizations. I think, I think about, other organizations like Dia de la Mujer Latina, who is always worth lifting up, and the amazing call center that was sort of like turned on a dime, to like dialed up on a dime to be able to answer people's questions as they came in. I think all of this was such a boost to many of us, and some of the long slog of Omicron, another variant, another wave. And just knowing that there is that power for folks to be able to go out there and help communities. I think, so many people in especially our communities that are often left behind. I think so often people feel like, well, these programs are not going to work for me. And if there are issues, then too bad for me. And that's just the way the sort of the world works. And I think community-based organizations, in part because of the responsiveness of like Dr. Webb and his entire team, community-based organizations have had such an important role in not only getting information out, which is incredibly important because you are trusted in communities and you're the people that folks turn to, but also getting information right back up to the White House and the folks at USPS, and making sure that all the challenges that are out there are really understood and are being addressed, because every community is different. Every community's needs are different. In every moment it's different. And it is only with that on the ground feedback that we can really sort of like be able to tailor programs to be able to take care of everyone who most needs it. So, that there is a huge thank you here. My whole presentation is basically a huge thank you for all the organizations out there, whether you're community-based or national, sort of all the work that folks have been doing to really make sure that resources are getting to the people who need it the most. I think moving forward, I think there will be continue to be important work to be done to make sure that all of those households that have not signed up for tests yet and need tests, that they know that they are eligible to get those tests, that they are available to them. They don't have to pay for them. All they have to do is sign up, and they'll get them in the mail. Their information's not going to other agencies or anything. It's just for the purpose of the Postal Service slapping your mailing address onto a package and sending it to your house. I think that piece is incredibly important. I think the other piece will be explaining to people sort of how do you use the test? When do you use the tests? What do you do when you test positive? Connecting people with all the public health resources that are out there to help answer all of those questions, I think will be incredibly important, particularly sharing that information in culturally competent, in language ways, in ways that are accessible for folks who have disabilities, really making sure that the information that people need is given to them in a way that is tailored for them, which I know is the specialty. It is the special sauce of community-based organizations. And so with that, I'll just say again, thank you to everyone who has been a part of this process. There is so much more to be done. And I look forward to answering questions after the next section.
Well, thank you so much, Dr. Chen, for really reinforcing the power of community-based organizations and how incredibly important they have been in all of this process and will continue to be. And such a nice setup for our next two speakers from the CDC, our colleagues there, to give us some of the nuts and bolts about the different types of tests and what are some of the additional federal resources available, et cetera. So we're going to shift our focus now to our next presenter, Jasmine Chatram from the CDC. She is the lead for the expansion of screening and diagnostics task force working on the pandemic response at CDC. And she's going to discuss additional federal resources available for COVID-19 testing. And then we'll move to another colleague from CDC who'll talk about some of the nuts and bolts of testing. So Ms. Chatram, over to you.
Thank you so much for the introduction and good afternoon, everyone. It's been said already by Dr. Waddell that I'm going to talk about federal resources, and it's been mentioned in the last two speakers a couple of times about the free COVID tests that have been mailed out and ordered and are available. And I'm going to talk about some other resources that are also available to individuals. If you can go to the next slide. So there's two programs right now that CDC is managing. The first one is called CDC's Increased Community Access to Testing, or ICAT. And then we have CDC's Operation Expanded Testing, or we call it OPET. And both of these programs are heavily focused on trying to improve access to testing in communities disproportionately affected by the COVID-19 pandemic. The ICAT program is really focused on setting up no-cost testing in pharmacies nationwide. And we've worked very closely with Walgreens, CVS, and Rite Aid to provide this testing resource. And we have worked with states to determine, locations of where we should open these testing, and also obviously with the pharmacies. And while ICAT is helping with the setting up and negotiating contracts with these pharmacies to do the testing, those include also providing medical personnel, test kits, and courier services if specimens need to go to laboratories. The Operation ET is a slightly different focus, where we're providing this testing to childcare centers, K through 12 schools, historically Black colleges and universities, under-resourced communities, congregate care settings, homeless shelters, domestic violence and abuse shelters, correctional facilities, and other places that where there's community needs. If you go to the next slide, please. So the ICAT program I mentioned has testing available in large chain pharmacies. We also have surge testing sites that we're standing up in jurisdictions, and this is more where the states come in to help us determine where those needs are. And usually we work very closely with the state. The state can submit a request if they feel that there's a specific community where there's a high incidence of COVID or there's lack of testing access, and that's coordinated through the Federal Emergency Management Agency, or FEMA. And that's through a form that's filled out on a website, and all of this happens, all the logistics are discussed, and we work closely with the state to determine the best place for the site and what the needs might be. Next slide, please. So it's been mentioned already, the availability of the over-the-counter test. These are the self-tests. These are tests that individuals can perform at home or anywhere, really. They are available in pharmacies and other retail locations, even Amazon, for purchase. But as you heard, the US government has made a significant effort to distribute these tests broadly through a website and ordering accessibility, and they're free. We are also working very closely to distribute about 50 million of these types of tests to community health centers and rural health clinics. So not just sending them to people's homes, but also community centers. And my last bullet kind of covers, where you can get those tests. And the initial conversations about distribution of these types of tests was around 500 million. We're hearing now discussions around 1 billion as the goal. Go ahead, next slide. I mentioned the testing at the schools. That's through the ICAT program. That is a laboratory program, where a laboratory-based testing, and you'll hear a little bit more of that from Dr. Barnes next. But basically, a specimen is collected and sent to a laboratory, and the turnaround time for that is a little bit longer. So we're also equipping these schools with point-of-care testing, and that allows parents and families and schools to have results a little bit faster on whether or not that child or that individual might actually be infected with the COVID-19 SARS coronavirus 2 virus. And the capacity that we have for this testing at these schools is about 5 million tests. And we will continue to provide this testing nationwide, and it's accessible. You can check out our links here or send an email if you need to have access to this type of testing. Okay, next slide. And I just wanted to mention quickly some of the resources that we have on our CDC web pages. We do have a CDC web page for self-testing information. There is a lot of information on that page, and we're getting ready to post some frequently asked questions, specifically about the orders that are being placed for the free COVID tests. We also are going to be placing, hopefully soon, some very specific instructions on how to perform tests. There are videos right now on how to use a self-test, and they're very generic. There's lots of different self-tests out there. There are different instructions for some of the tests. Some require 4 drops, some require 3 drops, some require 15 minutes, some require 30 minutes. The manufacturers of these tests do have videos, some of them, and we will try to post links on our webpage to those videos to make them more accessible. We also have infographics with a QR code at the bottom, and we've been talking to pharmacies about placing this information in their stores so that individuals can come up, scan the QR code, and it takes them straight to our self-testing page where they can find all of our resources. So as I mentioned, we do have these 2 videos. We are working with organizations that assist the disabled, the blind, and the deaf specifically, to try to develop materials that would reach this population as well. We've been talking, I actually have a meeting set up tomorrow to talk to somebody about developing videos for sign language. Our videos that we have posted now that I'm showing you 2 of them, how to use a self-test and how to interpret the results of the self-test. These are videos that do have closed caption, but we are hearing that may not necessarily be enough. And so we are considering how can we have a sign language interpreter provide the information. We're also thinking about how we can get our infographic that we have here, which is in a few different languages. But we also are thinking about how we can convert that into Braille for those individuals that are blind. And I think that is my last slide. And so I will stop there.
Thank you so much, Dr. Chatram, for sharing that information. And certainly those are really great tangible resources available to our audience. And we certainly encourage you all to check all of those out. And it certainly sounds as if the upcoming FAQs as well as instructional videos will be really helpful. So let's move to our next presenter, and that is Dr. John Barnes, also from the CDC. And Dr. Barnes is the team lead for strain surveillance and emerging variants, and he's going to provide an overview of COVID-19. What are the different types of tests, and what do I need to know? So, Dr. Barnes, over to you.
So thank you very, very much for the opportunity to present to you today. I am a laboratorian, and so we don't come out from behind the off the bench very often to present these sort of things. But one of the things that my lab does is actually produce diagnostic tests. So I'm going to give you some presentation today on how diagnostic tests can be interpreted and read, and try to make sense of some of the questions that I've seen go on in the chat and some other things like that. So next slide. So these are the viral tests that are authorized to detect the SARS coronavirus 2. They're can be grouped into 3 main groups. One is a laboratory-based test. The second is a point-of-care test. And the third, we've talked about a lot today, are these self-tests that are being sent out. And so laboratory-based tests mostly are categorized as nucleic acid amplification, or what we call NAT tests. These, in the case of the SARS coronavirus, are actually detecting the viral ribonucleic acid within the coronavirus viral particle. And so these are complex. They usually require a longer turnaround time. It can be more expensive to run. They usually run more samples at one time. But they are very highly sensitive and specific for various targets within the SARS coronavirus genome. These all require having a CLIA-based certificate of accreditation or compliance. And so these are ones in which we are very complex tests to run and require multiple pieces of equipment. And so these are necessarily CLIA accredited. The point of care test that have been somewhat popular here and that we've actually had in the SARS coronavirus pandemic are both nucleic acid amplification test and antigen. And these are what we call moderate complexity tests. They have a faster turnaround test and moderate cost, but they don't require some of the larger pieces of equipment or high complexity that some of the laboratory-based tests require. They have a little they are a little less sensitive because of that fact. It varies by the test, but some of these are actually quite sensitive. But in general, they're moderate sensitivity, and these require a CLIA certificate or waiver. In some cases, these can be CLIA waived. The self-tests that are we've been talking a bunch about today, these are mostly antigen. They're easy to use. They have a fast turnaround time. They're inexpensive, and they have lower sensitivity but good specificity and no CLIA requirements. So I've seen somebody actually ask a difference between sensitivity and specificity, and it's a great question. Sensitivity is how few viral particles can a test detect, okay? How low can it go, if you will? And then specificity is are we sure that only the SARS coronavirus 2 virus is being detected with that? So specificity is specific for that, that particular test. And we want to make sure that the specificity and the sensitivity are both good on our diagnostic tests so that we don't pick up false positives or negatives. Next slide. So the question is really when to test. And if you're symptomatic, the rule is test immediately as soon as you can. If you've had close contact with someone with COVID-19, at least within 5 days after that contact, test at least 5 days after that contact. Usually it takes a while for the virus to actually grow in your body and produce enough signal for a test to actually detect. So while you may have had contact, if you test immediately, then you may not actually see a pending infection. If you're some of the other things that you want to consider are if you're going to be attending a gathering with other people, that you know is going to be large, you're going to be unmasked at that gathering or in close contact at that gathering, especially if you have people that are at risk of severe disease, older individuals or those immunocompromised, then you want to test before that gathering. And so that you can use that to actually help you understand your positivity status before you attend. Next slide. So which test to use? The best test to use is the FDA authorized one that's the most accessible to you. Laboratory-based tests do have a higher sensitivity than point-of-care and self-tests, but laboratory tests have a larger turnaround time, as I mentioned in the beginning. So if you have had, if you are going to be in contact with somebody in the next couple of days, then you want to use one that has a tool. When it is most important to avoid false negative results, and when those that are potentially you're going to have contact with have the highest risk for severe disease, then it would be better to use a laboratory or NAT-based test as opposed to an antigen-based test. Those assays, NAT-based assays in general, are more sensitive. Those at highest risk for severe disease, defined in this, is those with underlying medical conditions, immunocompromised older individuals, and the unvaccinated. Next slide, please. What do you do following a positive viral test? A positive viral test means the test detected the virus particle in some way, shape, or form. So, and you're very likely to have an infection for that. Positive tests are reliable for laboratory-based tests, POC tests, and self-tests. So all of those tests in general, if you have a positive result, that is a very reliable positive. Follow CDC's guidance for isolation and tell your close contacts they may have been exposed to the virus that causes COVID-19. If your symptoms worsen, tell your healthcare provider. If you have any emergency warning signs, seek emergency care immediately. It is important to seek medical care and possible treatment if you have an underlying medical condition that increases your risk with COVID-19. Your healthcare provider may prescribe treatments that will reduce your risk of severe disease. Next slide. The virus, what does a negative viral test mean? The virus that causes COVID-19 or SARS coronavirus 2 was not detected in your specimen. You may have a lower risk, therefore, of transmitting the disease to others. The problem with negative tests is that it does not necessarily rule out infection. This can be because it is your infection at that point in which you have taken the swab is below the limit of detection for the test, or that the specimen was compromised in some way. So it does not rule out infection, and you should always understand that. Next slide. Following a asymptomatic negative viral test result, if you have no close contact to someone with COVID-19, regardless of vaccination status, you do not need to quarantine. If you're up to date on vaccination of any exposure to COVID-19, you also do not need to quarantine. Remember, this is asymptomatic negatives, okay? If you're not up to date on vaccination, but you have had close contact with someone with COVID-19, then you should quarantine. Again, because a negative test result is less predictive in value than a positive result. Next slide. Following a symptomatic negative viral test result. If you have symptoms and you are negative, though, on your test, you should still isolate for 5 days from your first day of symptoms, from the day your test specimen was collected. If you have a negative antigen test result, negative antigen tests have less sensitivity than that test. And so you should consider what is called a pretest probability. What this is a high pretest probability is the circulation of the virus of the virus in your community high at that point in time? Or do you have suspected exposure to a person with COVID-19? If those are true and you have a negative antigen result, then the pretest probability of that negative result is pretty high, okay? If a high pretest probability, consider confirming that result with a NAT or use multiple antigen tests called a serial antigen testing. NAT can be used in the nucleic acid amplification test can be used as a confirmatory test as soon as possible right after an antigen test. Or a serial antigen test can be done 1 or 2 days after your first antigen test to confirm the first result. Next slide. Confirmatory testing. Symptomatic antigen negatives followed by a NAT test. Essentially, so exactly what I was talking about just earlier. If you're symptomatic and you have a antigen negative followed by a nucleic acid amplification test. If that nucleic acid amplification test is negative, you may have something else. Coronavirus, although SARS coronavirus is what has been in our minds for the last 2 years, influenza and RSV and rhino are continuing to circulate. And so you may actually have a different virus or a different reason for your disease. If that is positive, go ahead and follow CDC's guidance for isolation and tell your close contacts that they've been exposed to the virus. In essence, your nucleic acid amplification test if it is positive, it kind of trumps that original antigen result. Self-tests. Positive results really do not require confirmatory testing. They're very reliable. Negative results may need confirmatory or serial testing. The reason is that it is very hard to control for the general population for actually taking a correct swab. One of the things that we do in diagnostic testing is we try to understand how good a swab is taken for a particular person. And if you've used nasal spray or some other things like that ahead of time, that can affect results. So a negative test result may need a confirmatory or serial testing especially if you have symptoms. Next slide, please. Serial testing. Symptomatic antigen negatives followed by another antigen test. As I said before, this can actually help the sensitivity of antigen tests. Remember that when you're testing at that one point in your viral disease going on within your body. And at that particular point, you may be below that antigens test limit of detection for that particular virus. And so multiple antigen tests or serial antigen tests can help clear up some of that evaluation. Serial testing can also lower the risks of transmission regardless of symptoms or vaccinations tests. Multiple negative antigen tests, if each test is separated by 24 to 48 hours, can provide more confidence that you're not really infected by the virus that causes COVID-19. But always refer to manufacturer's instructions on the best way that those are done. Next slide. So this has been mentioned a lot before, and I will go into it. These are how to get free self-tests. This is another call out. We can just go ahead with this. Next slide. And then here are, I know I gave you a lot of detailed information today, and I'm very, very sorry that it is very specific. It's very hard to get this across, but here are resources on the coronavirus 19 testing. So these are links that are in this presentation, and they're links to web pages that we have available about all of these different types of testing, and you can dig into these on your own if you have more questions than we get to today. Thank you very much.
Well, thank you so much, Dr. Barnes, for sharing all of that information. I do want to remind our audience that the slides will be available to you because Dr. Barnes had a lot of really great information in those slides, and there are a lot of different scenarios, as I sure you all appreciated through his presentation, that will be helpful for you to have those slides to refer to when you're getting questions. So we're going to bring our panelists back, Dr. Barnes, Ms. Chatham, and Dr. Chen, if she's still available. She may have had to leave. And see if we can cover a few questions. So I think one of the questions that has been coming up a lot is people that are experiencing homelessness and where they can access some of these free tests and how they're able to do that. So wonder if either of our presenters that remain with us are able to answer that question.
Yeah, I can take a stab at that. So I mentioned that the Operation Expanded Testing Program is providing testing for homeless shelters. So we are shipping point of care tests, and Dr. Barnes covered the point of care test in his presentation, to those facilities so that they can be used by individuals if they are at a homeless shelter. These tests, they're also over-the-counter tests or self-tests that are being distributed to these facilities. And so I think homeless folks have the option to either perform the test on themselves or have someone help them perform the test. And I guess it would depend on, their ability to do either one of those. Over.
So another question that we're getting a lot is what's being done to encourage people to upload their, what's being done to encourage people to upload their at-home test results? And how is that data being shared with the public?
So there are some tests that are sold over the counter. These are the at-home tests that come with an app. So if you purchase this particular test, you are sometimes required to fill out the information in the app in order to get your result. And that helps to facilitate the reporting of those results to public health. There are some that, it's optional on whether or not you want to report. We have communicated to individuals on our self-testing page and in our self-testing videos and all of our resources that are out there that if you do test positive, it's recommended that you contact your healthcare provider, who would then report that to public health authorities. It's not required right now for individuals to report their results from a self-test. There are some concerns about self-tests, and Dr. Barnes covered that. If the sample is not collected properly, you might get an inaccurate result. There is also difficulty verifying who actually performed the test. So when we go to do public health actions like contact tracing, it's questionable because there's no way to validate that who the individual was, or that the positive is associated with them. So we are collecting this information, but in general, we are relying on laboratory-based tests that are reported from laboratories in the millions daily to help us understand the state of the pandemic right now with regards to the number of cases and percent positivity. Over.
Okay, thank you. So Dr. Barnes, a couple of quick questions here for you. I believe there was a question regarding, can you clarify again the difference between point of care tests versus a self-test?
Sure. Point of care tests are defined generally as they require laboratory equipment. Some of them require pretty decent size laboratory equipment that a person normally wouldn't have in their home, and is more expensive than a person really would have. A lot of them are based on very, very similar technology that is done on some of the self-tests, but it's generally they're rapid turnaround. They will find them at pharmacies and other places like that, in which they can do a quick turnaround on those tests, but they may require a reader that is several $1,000s or whatever that will actually read the test. And so those are point of care. This rapid test that we're doing for home-based tests are very, very similar, and the technology often is almost identical, but it is just one that can be done and read at home as opposed to having a specialized piece of equipment involved.
Right, thank you. And another quick question, I think, is the NAT test the same as a PCR?
Yes, so now PCR is one category of NAT-based tests. There's other NAT-based tests as well. There's a technique called LAMP, which requires more primers and amplification than a PCR test, but is also being used. There's also some CRISPR diagnostic-based tests and other things like that that are in the NAT category, but PCR and NAT are fairly interchangeable, yes.
Okay. And Ms. Chatham, I think this goes back to you. Does ICAT or Operation Expanded Testing include daycare centers?
That is a good question. And I believe I was on a conference call earlier this week where we were talking about expansion into healthcare centers. And I'd love to just check my notes really quickly if I can, because then I can give you accurate information. But there was a conversation about working with an organization that would help us to identify those daycare facilities that need assistance. And I'm sorry, I can't get my hands on it right now, but it is something that we're exploring. And we are working on it. That's all I'll say.
That's great. We can certainly follow up on that. And so this will be our last question. But if you all could please address concerns about the accuracy of rapid tests early in Omicron infection, even when symptomatic, as well as the use of throat or saliva swabs along with nasal swabs, and the public health messaging related to those issues.
Sure. So there is, FDA came out with some information about the antigen-based test and Omicron variant. And they have seen a couple of tests that have a little bit of a reduction in sensitivity of those antigen tests. Part of it is due to what we call the tropism that they're talking about, which is a lot of antigen tests are not actually qualified for a throat swab, particularly point of care tests, because we don't want people jamming a swab into the back of their throat by themselves. That's not a good idea. So the between those two, there is some reduction in sensitivity, but looking at the data, it isn't so severe that those tests aren't accurate. And the FDA's response is that they are encouraging people to actually have to test manufacturers to work on those particular qualifying, like an internal cheek swab or something like that for that. That's one of the things that they're doing, but they will continue monitoring this. But realistically, the tests are still working pretty well.
I just wanted to jump in real quick and say that I did find my notes, and it's National Head Start is the organization we're working with to connect the Operation ET with the daycare centers.
That's great. Thank you so much for that. Well, again, thanks everyone. You should see on the screen a post-webinar survey. And again, we really appreciate you all taking the time to complete this survey, to give the feedback and also your suggestions for topics that would be most helpful for you going forward. Certainly want to thank our speakers for sharing their time and the important information. Dr. Webb, Dr. Chen, Dr. Barnes, and Ms. Chatham for your time and expertise today. We heard about at-home tests, self-tests, where you can order them online or through a phone number. Some updates about what to expect around the free mask and when, where they may be coming and when. The importance of providing feedback from Dr. Webb, the power of community-based organizations, and a lot of really important brass tactics, if you will, nuts and bolts around testing, the different types of testing, what to expect from various results, and the types of programs and resources available through our CDC colleagues. So we certainly encourage you to take advantage of those resources and stay on the lookout for the new resources that are going to be added to the CDC website. Again, we want to thank all of you for your attendance and participation. We know that there are always so many questions, and we try to sort of bucket and get the themes and put some of those questions out for you and get those answered. We will be sending a copy of the recording out to everyone who registered. So you will be getting the recording and have access to those materials. And you can always find that also on the CDC Foundation website within a couple of days of this webinar. So with that, again, thank you to all of you for your ongoing work and your commitment. And we look forward to having you join us at our next webinar in the near future. Have a great day.